antidepressants. Should they be taken or not? What should one know about them? To start with, let us talk about the term depression. Depression is characterized by the following symptoms: low mood, reduced performance, impaired mental processes, for example, poor concentration and slowed thinking, a feeling of no prospects in life, lack of satisfaction from routine activities, neglecting hobbies and interests, low sex drive, sleeping disorders, for example, inability to fall asleep, superficial sleep, or waking up very early in the morning with no feeling of being well rested. Changes in appetite. It can either be decreased or increased. Anxiety. Feeling sluggish or, on the contrary, agitated. Feeling tearful. Having suicidal thoughts. Fatigue. Feeling guilt-ridden. Depression can be caused by traumatic events. However, it can also develop for no apparent reason. It is believed that if a person has suffered a bereavement, his emotional state is supposed to start improving in a month. If it is not the case, or even worse, the emotional state starts deteriorating, then it's a sign of depression. In the last 20-30 years, there have appeared a lot of patients with a typical depression. It means a person does not complain of low mood, but he has bodily symptoms such as headaches, chills, hot flashes, a pain in the chest, stomachache, lack of energy, the state of being worn out. In case the symptoms persist over 3 months and the reason for the bad state can't be determined, the chances are high that the person suffers from a depressive disorder. With the above-mentioned symptoms, you can be prescribed antidepressants. What should one know about them before the treatment starts? Antidepressants are strong medications and, as a rule, are prescribed for not less than 3-4 months. Consequently, the treatment has to be supervised by a highly qualified specialist. Antidepressants need to be taken for around 2-3 weeks in their full therapeutic dose before the benefit is felt. Till then, there can be little or no effect. That is why, at the same time, other medications, for example tranquilizers, can be prescribed. As all medicines, antidepressants have side effects. As antidepressants influence psyche, most side effects are psyche-related. It makes patients apprehensive and worried. That is why it is recommended to start antidepressant treatment gradually. It means on the first 4 days, 1/4 of the therapeutic dose. Starting on the 5th up to the 8th day, half the dose. Starting on the 9th up to the 12th day, 3/4 of the therapeutic dose. And only from the 13th day, a full therapeutic dose should be taken. The above-mentioned doses ensure a smooth therapy start. The process of stopping antidepressant therapy also has to be done gradually, slowly reducing the dose. It means 1 week, 3/4 of the dose, the next week, half the dose, and the next week, 1/4 of the dose. Antidepressants can influence different body systems and organs. However, it does not mean that all patients treated with antidepressants will show side effects. The doctor's task is to find the very medication and the very dose that will not cause the patient any discomfort. Nowadays, there exist a great number of medications, so in the majority of cases, it is possible to find the most suitable one. Antidepressants do not cause acquired tolerance, which is a necessity to constantly increase the dose in order to achieve the former effect. Antidepressants do not cause dependence, which is characterized by a withdrawal syndrome when discontinuing the medication. Often, dependence is confused with the so-called rebound effect, which means that the state may deteriorate drastically when discontinuing the antidepressant abruptly. However, not all patients suffer from this effect anyway. In order to avoid the rebound effect, the antidepressant dosage should be reduced gradually, possibly involving a sedative at this stage. However, it all should be done under a doctor's supervision. It's important to know that antidepressants do not change one's personality. They just influence one's perception level of emotional stresses. So a good person remains good, a bad person remains bad. Antidepressants do not change the brain structure. They just influence the neurotransmitters level, that is of serotonin, noradrenaline, dopamine. But it is wrong to assume that a patient's state and mood depend only on the level of neurotransmitters. The efficiency of antidepressant therapy mainly depends on two factors. First of all, the patient's readiness to follow the doctor's prescriptions and instructions. And secondly, the doctor's willingness to listen to the patient in order to adjust and individually tailor the therapy. Nowadays, there exist a great number of antidepressants, so it is almost always possible to select the most suitable and efficient therapy.